This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner. I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
Good. How was your Thanksgiving, Amy?
Well, if it was full of candy corn turkey cookies, it was amazing.
Candy corn. We got to get through this candy corn part.
Well, after Thanksgiving, the candy corn is gone.
Yeah.
For like a whole year. I always wish I'd eaten more.
I love Thanksgiving. I love food. I love family and friends. It's one of my favorite holidays besides Halloween, which we've established previously.
Yep. So it gets sandwiched right there in between Halloween and Christmas.
So, yeah.
Well, we have an awesome episode today. One of our actually most watched episodes ever was our first episode on brachioplasty or arm lift. And at the time, before we recorded it, Dr. Martin said, no one knows what brachioplasty is. They're never going to find it.
Yeah, that's because I know all the stuff that goes on the internets.
It turns out that people do know what brachioplasty is, and they're super interested in it. So we are...
Just rubbing it in.
Yeah. Today, though, we're talking everything you need to know about brachioplasty. So we're going to break down the procedure, recovery.
So we don't have a number. It's not brachioplasty 2.0.
No, it's everything.
So we're flipping the scripts.
Everything you need to know about brachioplasty.
Yeah. Brachioplasty is one of the most transformative surgeries we do. It also has some preloaded kind of thought process that people come in with. They're like, I would never do that. Like, it's the common theme. Like, there's no way I would ever put a scar on my arm. And actually, after you talk to them about it and go through everything, which we're going to go through today, a lot of people say, oh, yeah, actually, I would do that.
Yeah, I think it's one or the other.
Kind of misunderstood.
Yep. I think it's either people know they absolutely want it and people who wish there was something else.
Yeah.
That's
Maybe that's a better way to say it. There is not
Yeah.
anything else, even though we do body tight all the time, and that works really well. But brachioplasty is its own amazing surgery. It's very transformative, but you have to...
If you need a brachioplasty, that is it's like with any surgery we do, though. If you need a facelift, you need a facelift.
Yeah.
So nothing wrong with that at all.
No.
Yeah. Well, let's jump right into it. So we always start these episodes where we talk about procedures with the statistics from the previous year.
You did pretty good.
I did pretty good on that one. Yes. So we are
She's been practicing in the mirror.
Statistics.
She's been looking and saying statistics. There you go.
2022 statistics is even harder to say.
Oh, it's very hard.
So the statistics we're looking at are from actually 2020 because we're always a year or so behind in collecting data. But if you look at what I found really interesting about this was that the numbers of procedures performed, very minimal change. If you've watched a few of our other episodes from this year, obviously the change between 2019 and 2020 was pretty drastic on some of these procedures, but to have only a 17% change on a procedure that is rather niche, I found actually really amazing.
Yep.
Like that to me was very, very cool. The breakdown between men and women, which I think is a neat thing that they're doing now, the difference, we had a little over 14,000 of the total was women and only 338 men. Definitely not as common with men because men's skin has a lot more tensile ability to kind of bounce back. Even when a man is very overweight, it's rare that their arms carry a lot of that weight. Whereas with women, even women who may not even have ever been really clinically overweight in their life can sometimes just carry a lot of heaviness in their arms. Yeah. Like just have those really heavy arms.
Yeah, we talked about fat distribution with hormonal like milieu. So
and genetics.
You're going to see with women, they carry fat more in the arms than men do.
Yeah.
For sure.
Yep. And even normal weight women can have this problem.
And that's true on the legs also. So men carry weight more centrally. That's why they have a higher incidence in some cases of heart disease, because central visceral fat. Women, you'll see it on the extremities. But it's interesting that 338 males.
Yeah.
I bet you it's more. I know this is like self-reporting.
Well, this is the first year that they've broken down male and female. So I think we'll get better at that as data collection kind of improves.
That doesn't seem like that much.
No, the thing I found most interesting about this was the age distribution, that the highest percentage was actually 40 to 54. Definitely. And then over 70, there were still almost 900 people, 800 41 people over 70. So it goes back to our recent podcast where we answer the question, am I too old for this procedure? Like, no, as long as you're healthy enough for surgery, even a surgery that has a very long incision, like a brachioplasty, is very, very safe as long as you're healthy enough for surgery.
Right.
So yeah, the breakdown is pretty even between like 30 and 70. You know, it doesn't change a whole lot, but definitely the biggest concentration is going to be between that 40 and 60. And then 30 to 40 is the second. And then everybody else kind of falls to those outer edges. But definitely a pretty common procedure for a more, I would call this common for a specialized procedure.
But I would love to see the 70-year-olds rocking out their 70-year-old like super tight arms.
I mean, we have several.
Yeah, we have a few right now.
Yes, we do. So, and not to, tease the final too much, like I like to do with the monsters at the end of the book, but there are going to be before and after pictures. So stay around for those. And one of them is a patient in the older age range, and one is kind of in this more moderate, 30 to 50 range. Yeah. So one of each to see. All right. So let's talk about the different types of brachioplasties.
Okay. So Amy, how would you describe this so people can understand what a full brachioplasty is?
Well, we'll talk about the incision location on these, but just the main types to know that there are three basic categories of brachioplasty.
So a full brachioplasty covers the whole arm from your armpit to your elbow, basically.
So upper arm.
It could go past the elbow if you need to. That's rare. But for people with notable weight loss, a lot of loose skin, it's going to cover the upper arm from the elbow to the armpit. The mini brachioplasty is going to cover the upper third of the arm at the most, if you're lucky. And then you can also have an axillary extension to these surgeries, or extending onto your chest wall through your armpit down to your chest wall. Mm-hmm. And that's for true people that have kind of bariatric surgery, weight loss greater than 50 pounds, 60 pounds, something like that, where they come in, they have a lot of excess skin on that underneath the armpit, but what you would technically on a woman call a bra line. So you can have an axillary or a chest wall extension of that full brachioplasty. Theoretically speaking, you could just do an axillary brachioplasty or an axillary excision, but that's rare. It's almost always an extension from a brachioplasty.
Yeah, like an add-on, like an extended brachioplasty.
If you were going to do this in axillary alone, it would have been a situation where someone's already had a brachioplasty, probably. Yeah. And we've had one or two of those.
Most likely. I mean, there is a rare person, though, who their arms bounced back really well from their weight loss, or that was just never really their issue in the first place, but they do have a lot of that excess skin in the side of their chest, essentially, or like that armpit area, the axillary or the armpit, like an armpit lift, which does happen on men and women. So basically 3 options for brachioplasty is going to be your full, your mini, or your short incision, which is not going to give as much of a result. Also, probably not as many people are a candidate for that. And then kind of either the add-on or the potentially standalone of that armpit lift or the axillary
Everybody
lift.
wants to be the mini candidate.
Yep.
If you ever say the word mini, that's what they want.
Yeah.
But there's the candidates are few and far between that come in our office.
Yeah. And typically they're younger, have less skin laxity overall. The laxity doesn't extend past really even that upper quarter of the arm. So like really high up on the arm. And we have some patients like that who just have this unusual like dip, right there. Right at the very top of the arm, right by that where the arm meets the body.
And the dip she's talking about, if you put your elbow out from your body at a right angle.
Yep.
If you look on our YouTube channel, and it's the upper part of the arm right before your armpit that dips down. You see that in a lot of different people, and it can be people that actually have pretty good tone to their skin, have good muscle mass, but just have a little excess skin at the proximal upper arm. And those are the types of candidates that would have a good result with a mini.
Yeah. So where do the incisions go? We kind of covered that a little bit with these, but I think the thing that people don't think about as much is even with a mini brachioplasty, mini, full, or axillary, you are going to have incision that is in your armpit for sure, which means things like you may not be able to shave or wear deodorant for several weeks. And then the incision is going to extend down the inside of your arm to and or just past your elbow on most people.
That's for a full. Yeah.
Yeah. Well, it extends anywhere between the armpit and the elbow.
Right.
It's going to go somewhere along there, whether it goes all the way past, just past the elbow, or goes just a few inches past the armpit. Like it's in the same location. It's just how long it is.
And so that location is, if you're standing straight looking in the mirror and you put your elbows out at a right angle, because you're going to show your biceps. That's what Amy does every morning when she wakes up.
Right. She wake up and double bicep curl in the mirror.
She does the rock. She does the rock routine. And actually, if you make a muscle, and you can feel the groove between your triceps and your biceps, Amy, how would you explain those muscles, Mrs. Anatomy?
Well, the front of the arm and the back of the arm.
Okay.
I
Yeah.
think most people know biceps and triceps.
I would hope, but
yeah,
you never know.
They're pretty basic
Okay.
ones.
Anyways, that
Your pulley muscle and your pushing muscle.
that was pretty good. That was a good one. Yeah, pulley pushy. I can't. Now I'm talking like you. So that kind of demarcation between your biceps and your triceps, that line is where the scar would be.
Yep.
Now you can adjust going up or down depending on kind of the anatomy you're looking at and where you want that scar placed. But that scar with your arms down, it would not be seen. So if your arms are at your side and you go to a reputable surgeon, a board certified plastic surgeon, and your arms are down, you wouldn't see it. But only be with your arms up and your chest kind of like your elbows extended out, that you would see that scar. And the scar in the armpit for a mini brachioplasty is usually at a perpendicular angle to the scar that goes along the axis of your upper arm, the scar that's between the pulley and pushy muscle. I don't think I'm ever going to think about those muscles differently.
You're in the gym like pulley, pulley, pulley.
Oh, look at my pulley. Look how big my pulley is.
Yeah.
I'm going to go up to random people. Have you seen my pulley muscle?
Right? Like check out my pulley muscles.
So, and that one would be perpendicular, but kind of like at the edge of your axillary hair or your armpit hair. Now, if you were to extend onto what we say the axillary component or axillary excision, which axilla just means armpit, and what it really should be is chest wall extension. That's probably a better way to put it, but we'll just say axillary for naming purposes. That would go kind of along the mid-axillary line, or a line. If you dropped a plumb bob, do you remember plumb bobs?
They still exist.
Oh, yeah, my dad used to do that all the time.
Yeah.
So if you know construction, you would just take a weight at the end of a string, and that would tell you like true perpendicular from where you're measuring from.
Yep.
Do you know what I'm talking about? Yeah.
Yeah.
Exactly.
Yep.
Same idea. So that would be straight down from your armpit. The midline of your armpit would go straight down on your chest wall. And it basically is the midline or the demarcation between the front of your body and the back of your body. So yeah, these incisions in some cases, especially in the arm, are visible.
Yep.
And they're in areas that would be visible with short sleeve shirts on.
Mm-hmm. Tank top.
Right. If you had an axillary extension, you had a bathing suit, you're a woman, a bikini, a bra, something like that, a workout bra or workout top, you would still see maybe that axillary extension too.
If someone's looking in your armpit. And I guess my question then would be like, when was the last time you were staring at somebody's armpit?
I look at your armpit pretty much daily.
Mine?
Yes.
Do you do it when I'm sleeping? Because I don't know that that's happening.
Well, since we don't live together,
Yeah.
I'm not sure how I'm
Sneaking into my house and lifting my arms up. Yeah.
Yeah.
Yeah, exactly. Even people, I mean, like you don't look
No,
at
that's the
somebody's
joke.
armpit.
I mean,
Yeah.
obviously, I'm not. I don't.
Exactly.
I don't know the last time I've seen your armpit.
Exactly.
Yeah.
Like I've seen your armpit.
And you wear scrubs.
Ever. Yeah,
Yeah.
exactly. I mean, I've never seen Nils' armpit and we box together. Yeah, because it's just not a place you stare at on a human.
I don't want to go anywhere near Nils's armpit.
Yeah.
Yeah.
Yep. But the incisions are placed in a location that is as discreet as possible. However, in certain situations, they will be visible. So that is important to know. And they're also in an area that is sensitive.
When I was thinking about us doing this episode, I was thinking about like how many times do you actually put your elbows out like this, stretch out your chest and your arms out in real life? It's not very often. Your arms are almost always down, or
like half, like
your
near
elbows
your
are
body.
at your chest and
Yeah.
you're bending your arms like that. Maybe you'll grab for something, but usually when you grab, you usually grab more like this.
Right. I mean, like looking at Nils right now, would I know if he'd had a brachioplasty? No. Same thing if I was looking at you right now, would I see it? No.
But it is funny because like people that are middle-aged, that era of people like to play golf. In golf,
tennis,
in tennis, and those are like two sports where like, you're pronated, your arm pronates out.
People see the inside of your arm when you're playing tennis.
So you'll see it, right?
Yep.
But like, how often do you stand like you do with a golf club, or a tennis racket? Exactly,
Yeah.
not very
Volleyball,
often.
yeah.
So
yeah, it's not common, and the scar heals. I mean, we've had a lot of episodes where we talk about scarring. I mean, scars are a consequence of a lot of surgeries. Most surgeries are going to have a scar that's somewhere visible if someone knows where to look for it. However, after a year when that scar is fully matured, it is very rare that a scar is truly visible to most people who don't know it's there. And I think the times we've ever had to revise a scar on an arm has been extremely rare. Like maybe right at the elbow joint, if there was like a little bit of thickness right there, but even that it's very rare.
Whenever you cross a joint, that's true with the armpit or the elbow, you're going to have probably a little worse scarring there because think about when you bend your elbow and feel the skin there. When it's bent, there's tension. When it's not bent or fully extended, there's no tension there. So you're putting theoretically a part of the scar on tension, which can result in bad scarring or worse scarring.
Yeah.
So, and that wouldn't be unusual that if you had to go all the way to the elbow or through the elbow joint that you might have to do a scar revision there. That's where it would be of all the places.
Yeah, but the rest of the scar, once it's healed, I mean, even patients, we have patients who've had a brachioplasty with us and then come back, for a different surgery. And I would say, I mean, unless I'm looking, I forget. I'm like, oh yeah.
Yeah.
They'll be like, you want to see my arms? And I'm like, why would I want to see your arms?
It kind of has
the
thighplasty feel to it too.
Like it just goes, that scar heals very well. It's in an area where there's not a lot of hair growth, which means that scar isn't impeded by really anything. It's not a lot of sun exposure. It's not a super high friction.
I never thought about that too. Because it's not going to be exposed to the sun very often because of just where it's located. Yeah. That's a good point.
Yep. So there's a lot of things that let this scar heal very well. There are definitely some challenges, and we'll talk about that when we talk about recovery with the healing of the scar. But for the most part,
I mean, there's not challenges for me.
Nope. But you're not the patient.
I mean,
if you were the patient, there would be.
Not challenging.
Yeah. So who's a candidate for this procedure?
People that, what do we always say? Number one, healthy, right?
Yep. Healthy enough for surgery.
Yeah. Number two, mentally in a good place, good. Kind of motivated and feeling empowered. They want to change. And three, people that have excess skin and soft tissue of the proximal arm between the armpit and the elbow, or maybe that extends onto your chest wall.
Yeah.
And those people usually have excess skin or laxity of skin, not just excess fat. Now, if you have excess fat alone, but the skin quality is pretty good, by and large, we're probably going to push you toward body tight or liposuction with some sort of energy administration. I guess, what are the other ones? Like lasers with liposuction, ultrasound, which is Vaser, whatever the different technologies are. But we prefer radio frequency energy, which is body tight, and we have a couple episodes on that kind of stuff. So if you have pretty good skin quality and fat alone, hopefully you're a candidate for one of these lesser invasive procedures, which, by the way, we do in the office under local anesthesia, 45 minutes, and you're totally awake. At
least to start, I would say if you have excessive fat on your arms, conservative liposuction may make some difference initially. However, as you age, it's unlikely that you would continue to be pleased with the appearance of your arms.
Are you talking about my aunts in Kentucky? Was that what's going on here?
No, I'm talking about all people. So like if you truly have excess fat on your arms, and
God bless my aunts.
Even all of these energy-assisted technologies, like they may be enough for you in the moment. However, as you continue to age, especially once you get past 40, 50, it's unlikely that skin laxity will maintain even with energy assistance. So just know, I mean, we tell our patients this too, like the ones that we maybe do just, an energy-assisted liposuction on, like you will likely need a brachioplasty in the future. And that's something your surgeon should tell you if that's the case.
Right.
Yeah. I mean, if you're just coming in for a little bit of excess fat on your arms and they're that you are of normal weight, have never been overweight, don't really have like
they
large
never changed
arms.
With pregnancy.
Yeah, that's
you don't
totally
have some,
different.
Like loose skin disorder. Yeah.
Then you probably aren't looking for a brachioplasty anyway.
Yeah. Well, and Amy's bringing up a good point. You have like those kind of people, or you have people definitively that need a brachioplasty, but those ones in the middle with fat and a little bit of loose skin, by and large, you have to think in your mind, even if you do body tight or something like that, energy assisted liposuction, that you're going to need a brachioplasty at some point in your life if you care.
Yeah.
But a body tight or energy assisted liposuction is additive to a brachioplasty in the future. And we've done that. We've done body tight and then done a brachioplasty on the same patient.
Yeah. It's like doing face tight and then a facelift. Like there's nothing wrong with using technology to push it as far as you can, as long as you know mentally that like you're spending this money and could potentially need to spend a lot more on formal surgery.
Right. Always comes down to money.
Well, I like to tell people that. Yeah. No surgeon's like, oh yeah, come back. We'll just do your next surgery for free. Yeah. No.
It's so funny when patients always say to us, or Amy, like, I just got, this money thing. And Amy and I both look at them like, yeah, we totally get it. Because Amy and I are both frugal. So we understand that kind of thought process. But sometimes if you think about it, if you're one of those patients that's really a gray area that, maybe you could do a brachioplasty early, but it seems kind of excessive. Why not do a body tight or energy assisted liposuction? Do this now, give yourself 4 to 5 years and do the brachioplasty later on. It's the same kind of thought process with face type, which we've talked about before.
Yeah. Yeah. So if you, man or woman, really anyone over the age of 18, if you're healthy enough for surgery, you're at a stable weight. That is one thing that I would add into this is you want to make sure that whatever weight you're at are stable, especially.
Like what surgeries do we recommend for people that don't have stable weight? I mean, that's pretty much a general recommendation, right?
It is, but specifically with arms, and this is what I was getting at, was that if
Didn't
you
let you finish?
potentially are on a weight loss journey or have had bypass or some type of weight loss surgery, you want to make sure that you're at a weight that's stable. You don't want to do it right as soon as you're like, oh, well, this is my goal weight. Like I'm going to do it right now. Like make sure that you have leveled off at a weight that's actually maintainable.
I was just wanted you to know that I was listening. I don't just give you perfunctory nods.
Right.
You know, I was listening to what you were saying and I was responding.
Yes.
I'm hearing you.
Thank you. Yes. So it is important. And same thing, like if you've just had a baby and you're like, wow, my arms look terrible, like get your weight to where it's actually stable again. And then
Totally.
and hormonally too, that's a big thing, especially for women, more not as much with men, but there's a lot of fat that's hormonally driven. So if your hormones are kind of all over the place, like you just had a baby or you just lost a lot of weight, like give it a chance to kind of settle. Surgery will still be there, you know. Make sure you don't want to have to do it again because we've done that with a patient who have lost like 70 more pounds.
Yeah.
So, which is awesome, but you know, you lose a lot more weight and this issue may represent itself.
The mountain became a hill, you know, that kind of thing.
Yeah.
So you have to kind of wait and see where you are.
Yeah. And that's a good thing. All right. Let's take a quick break. We're going to come back and talk more details about everything you need to know about brachioplasty.
We haven't even talked about the muscle building and the muscle tone and the pulleys and pushies.
We talked about the pulleys and pushies.
Okay. Let's get checked.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and it's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab or you're afraid of the blood draw or just, you know, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, you know, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30,
yep,
so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
You know, just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. You know, this podcast is about empowerment. It's educational. In my private practice, I'm a board certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah. So as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC. So TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 220. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right. Well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked. Just getting the pulleys
those
and pushies,
pulley muscles.
Pulleys and pushies.
I feel like I need to take my scrub jacket off so we can have a pulley off.
I don't know. Yeah, nice pulleys.
Nice pulleys. I'm going to say that in the gym tomorrow. Some guys like just ripping out some bicep
I just
curls.
hope that someone who's watching this thinks that's funny, because I think it's hilarious. Yeah.
Any of you go to the gym a lot will appreciate that. Yes. Like, hey, man, nice pushies.
Nice pushies.
Yeah. I mean, you push. Yeah.
I kind of like the triceps. I like those exercises.
I love working my triceps.
Because I feel like it's harder to get them to do what I want them to do, and every little like millimeter counts for the triceps.
Oh, because you can just burn them out until you're like gonna like drop something.
Right. You feel like you can't move anymore.
Yeah, it's good times. I can't hold your pen. We have no pathology over here.
None.
All right. So I hope everybody got checked.
Yep.
Wait till after the holidays, then get checked. Watch our episode about fasting. Start off the new year right.
Right.
All right. All right. Let's talk about alternative treatments and expectations.
Nice.
We actually talked about all of these, but I think it's important to kind of go over them again and the expectations that you can get out of alternative treatments. And these are non-excisional surgeries.
And that's a majority of the people that come in for contouring of their arms in our office are looking for this alternative approach.
But these are not patients who are reaching out for a brachioplasty.
No, but I'm saying that a majority of the people that come in, if you take all comers, they're looking for these alternative approaches, even if they are more likely a brachioplasty candidate. So these are very attractive to most people that hear about it.
Yeah, so liposuction alone, if you just have excess fat, liposuction alone is a great option. There's also combination therapies that Dr. Martin mentioned, like BodyTite, Vaser, Smart Lipo, all of these water jet, all these assisted liposuction technologies. All that's doing is adding on something to your liposuction. So something that's going to help boost collagen production, heat up the underlying tissues. Heat is a component of all of these. Heat causes damage. Damage needs healing. Collagen, elastin.
Damage is a component, like controlled damage.
It's controlled damage, with all of these. And that's, it gives you that little bit of tightening, or I always say with these though, and this is the one caveat, no amount of technology can pull or remove. So if you are grabbing and pulling, technology can't do that. What technology can do is help bring something closer, right? So it could lift it up a little.
Yeah, you won't let me use shrink wrap anymore.
No, it's inaccurate. It gives people an idea that is not realistic. And that's where,
Amy never lets us have fun here. We always have to be so honest.
Yeah, which is good for the patient. Then they don't come back saying, Dr. Martin said he was going to shrink wrap my arms, and look, they still move.
Yeah.
Like I can still wave them in the mirror.
Dr. Martin literally said he was going to shrink wrap my arms. They're not shrink wrap.
Step right up. I got the saran wrap right here. And then external skin tightening. So by this, I mean things like
Morpheus.
Vela Smooth. Yes. Emla.
Morpheus.
Yep.
Anything with deep needling and RF and all this kind of stuff. Just think about who's ever listening or watching this. Think about every dermatology office you go into and just think about the rooms that you sit in. You look at all the posters and like, it's going to make your skin super tight.
Yep.
That's every external treatment. And I've said this many times before, and I feel strongly about this. Anything external at best case scenario is going to tighten your skin 10%.
However, this might be a great option for someone who does not have excess fat.
Right.
Who's never been overweight, is maybe, just has crepey, loose skin.
Right.
Is afraid of a brachioplasty for whatever reason, or is not healthy enough for surgery.
I think the better way to say that is they have no other options.
Well, but maybe they don't.
Okay.
If you don't have fat, liposuction is obviously
But the problem is
not the right
crepey,
option.
loose skin patient's going to go into that office thinking that she's going to get this amazing transformation. And it's going to only make it 10% better.
Correct.
Okay.
But knowing that's
real
what I mean.
talk. Yeah, and then BodyTite or Vaser, like BodyTite, best case scenario for skin tightening, Vaser is pretty good. Laser lipolysis is pretty good. you're looking at maybe 20% improvement in skin tightening with fat removal. So the overall contour is, say, 30%, 40% better maybe.
Yeah. Which is a big difference. I mean, for most people, we think of an arm, an arm is a pretty small area. It's not like a leg. I mean, you can get, I would say, more change on an arm than you can get on a leg.
That's true.
Absolutely.
Yeah, that's absolutely true. The smaller areas, you can get more of a transformation. That's absolutely true.
Yeah.
And then...
and most people have bigger pulley-pushy muscles on their arms than they do in their legs because people don't squat heavy.
Yeah, that's true.
Or hip
We've
thrust
established
enough.
that. Squat ladies. When's that T-shirt arriving?
It's coming soon.
Okay.
Squat ladies.
Liposuction, especially kind of a higher level technique of liposuction right underneath the skin, can definitely cause skin tightening, about 5% per the data, and then removal of the fat at the same time. So all these definitely make an improvement. But if you think about what I just said, maybe best case scenario, you're a great candidate for body tight and hands like mine, as someone who is an expert in that kind of stuff, we're maybe looking at a 50% improvement.
Yeah, if you're young and healthy and
if you're
have
young
great
and healthy.
skin.
Best case scenario,
no
expert,
crepiness.
You're going to the place you need to be. You're you have all the check marks of have a good outcome. Now, have I had 60 to 70% improvement? Yeah. But that's few and far between, if I'm being honest, looking at before and afters. So in your mind, when you're hearing me say this and you're hearing Amy talk, I mean, is 50% okay?
For most people, yes. But if 10%, or if you're truly, if your surgeon is telling you you're truly a candidate for a brachioplasty, I think the bigger thing with all of these is to understand that the expectation, it cannot be that you're getting a brachioplasty from any of these procedures, no matter what somebody tells you. You will not get brachioplasty-like results from this procedure.
The inverse of 50% is exactly.
Yeah.
And if you do a brachioplasty, you can make it almost 100% better.
In
Legit.
most cases. Yeah. But these are good options. And I think something to be aware of, again, with the expectations is, and this is where people...
It's so funny. I'm always the one who likes the alternative treatments, and I feel like you're hedging a little bit. I hear it in your voice.
Oh, you don't know what I'm about to say. People want to believe that 50% is great. And you may go to a surgeon who says oh yeah, I can get you that 50%. These treatments, best case scenario done on someone who is absolutely only a candidate for a brachioplasty, can make it worse.
Yep.
So you can take that 50% that they tell you it's going to be better, and it can be 50% worse.
That's the problem. That's why we're doing this episode again.
Yep.
Is that you need to understand, if you are a candidate for a brachioplasty, like a true candidate, these other options are not going to help you, can only make you worse in most cases. Yeah,
if you have someone who over-aggressively liposuctions your arms when you already have a lot of laxity, that laxity will be worse. It will not be better. If they over-aggressively use these skin tightening technologies, again, the appearance of your arms can be almost disfigured. We've seen it.
Oh, yeah.
You can have tunneling. You can have very, very
Modeling
irregular
of the skin. You can have burns on the skin. You can have tethering. You can have deformities. I hate to use that word if someone is listening and has that, but it's really devastating.
We've seen it. So if you think you're embarrassed to show your arms from a scar, we've seen things that are far more embarrassing to show than scars.
Yeah, and I remember a few of those. We basically did a brachioplasty to get rid of
the scarring
that they had from these lesser invasive,
or the weird tethering or the irregularities. If you think someone holding their arm up and you see one thin little line of a scar versus someone holding their arm up and it looking like it's wavy and stuck and is scarred in, arms, because they are so mobile and they move. If you're standing behind somebody in line at a grocery store, you would not see the scar from their brachioplasty. But if the back of their arm was all bumpy and scarred and hanging even more from bad lipo, that you're going to see.
Another thing, and Amy's hopefully is going to smile at this one. Everyone, females in their 50s, 40s, 50s, 60s, 70s, whatever, they come in with this, not everyone, but a lot of them, with a cellulite appearance.
On the front of their arms.
On the front and the side. Mm-hmm. So you don't see it as often as in men because, as Amy said, the pushy pulleys are bigger.
And their skin integrity is just better.
Skin integrity is better, but those women, they hate it. Mm-hmm. That kind of crepey look to the arm that when it's down, the cellulite appearance on the side of the arm around where the fat is, extending down.
Even where there's no fat. I mean, on most people, there's really no fat right there. That's the problem. There's no fat right there.
And it's kills them when I say body tight's not going to solve that problem. And they're like, oh, you're the expert. What are you talking about? So-and-so sent me over here. They said you would fix this with body tight. I'm like, oh, it's not going to work. And that's, the only answer for those kind of situations. truly is a brachioplasty. Now, a lot of those patients are candidates for brachioplasties. You have to tell them that, like, hey, try some external treatments.
That's where 10% is what you can get.
Maybe it'll get better, a little bit better, but not much. And that's frustrating for, I think, a lot of women that come in.
It is, but there are a lot of things that you can do to improve the overall texture and tone of your skin, even without surgery. Just making sure that you have a high protein diet, you're getting enough collagen or collagen matrix, essentially, the building blocks of collagen in your system, hydrating well, exfoliating your skin. Like those things can probably make that same 10% difference for basically free. So optimizing those things also, is only going to make the results from anything better. And skin integrity, unfortunately, degrades as we age, no matter what. So
I don't know if I agree with you. Every time I see those posters, it shows an amazing transformation. Whatever the X treatment is, it's like, wow, my whole life would be better.
Right, if I just did that.
Yeah.
Yes. The other thing to keep in mind with pictures.
I like to believe in Shangri-La, man. I think that every time I go into the dermatologist's office, all those crazy devices are going to make my life 10 times better.
They will definitely make an impact on your wallet.
Yeah, they will.
Yeah, that's
make my life 10 times better and my bank account 10 times smaller.
Yes, it'll do something. But if you
we're gonna have some pitchforks out front with all the dermatologists and
they don't care.
Yeah, they're like yeah, whatever.
Exactly.
Martin.
Yeah, like they don't care. They're what is Scrooge Duck?
I don't know what he's talking about.
Yep, they're swimming in piles of gold. They're fine. Yeah, but
I'm just sitting over here. I don't know what's going on.
Yeah. But for those, out there who are considering one of these alternative treatments, just make sure your expectations are appropriate.
It's all about empowerment and expectations.
Yes.
It's the E words.
Yes. Now the big scary one, scars and healing. The two questions everybody asks, pretty much with any surgery we do. Will my scars be visible? Followed by, will everyone know? Will everyone know I had this done? There are definitely some things to think about. The scar is in an area that is potentially visible. Yep. Yes, in some situations, absolutely will be visible. It takes scars a full year to fully mature. At that point in time, even our patients who tend not to scar well with maybe other things, like these scars heal very, very well. They're hidden for the most part, and once they're healed, unless you are doing things that would make it very, very obvious.
It has to be like bright light. And your arm has to be in like a perfect position for someone to see it once it's fully healed.
Yeah. And they have to be looking. And again, that's what we brought up. Like
in most cases.
Yeah. How many times have you really looked at that part of somebody's arm unless they're trying to get you to look at it? Unless you're showing off your pulleys.
You mean if they were like showing off the pulleys?
Like then you might.
And like staring at it?
Right?
Yeah.
In the mirror at the gym, just pointing to signs to the beach.
I feel like Nils does that,
Well, he's got some nice pulleys.
When he was setting up the lights today, he was like... When I walked in, he was kind of staring at me with this menacing look.
He was benching the table. Yeah, he was just curling the table. But, will everyone know? No.
I mean, I was impressed, Nils. I was impressed. Thanks.
He does have nice pulleys. Will everyone know you had the surgery? No. I mean, that's the thing. We all think, because we know what this scar is for, that everyone knows what this scar is for. And I think there are some obvious ones, like if you have scars in an area like on your breast, like people are probably going to think you had a breast augmentation. However, a scar on your arm, especially where they would likely see it the most, right at your elbow, people are going to think you had some type of orthopedic surgery.
Yeah.
They're not going to think, and that can be the one thing, is that they see that and they're like, oh my gosh, what happened? They're going to think you were injured, not that you had surgery.
Yeah.
So it's the kind of the same thing with the thigh lift. If that scar is visible around the knee, people just think it's from knee surgery. Not everybody's mind is going to go to where yours goes because you know what the scar is for. Yeah, it's true. And I've talked to many, many patients who've had brachioplasties and asked them, have people commented on it? How has that experience been for you? And that is the one thing, like people who see it think that they had an injury 100% of the time. People don't say like, oh my gosh, did you have a brachioplasty?
I think you as a person would know if someone's like looking at you like, that looks really weird. So it's not like they're coming in like, yeah, no one said anything, but I feel weird when I'm around my friends or something.
Right, or I'm super self-conscious.
Yeah, it's just never an issue. We've never had a patient come in and say, oh my God, this is the worst scar. This has ruined my life. All the things you would imagine feeling if you felt very uncomfortable and insecure with a scar after a surgery like this.
And for the most part, people who are having a brachioplasty tend to be very self-conscious about this area anyway. So it actually makes it better. They feel better. Even they'll trade somebody seeing a small scar for the fact that they feel like their arm looks so much better. Their shirts fit better. Even if you're not wearing tank tops, like just having shirts that fit your arms, or not having skin that hangs over the top of your bra.
That's huge.
Those are things that.
So a lot of the women, but men too, but primarily women, they'll say, I want to wear a short sleeve shirt. It's not going to be super short. Whatever What is a sleeve length? Is there different names for different sleeve lengths for
Well, there's
women?
just like a regular short sleeve. There's 3/4 length and full.
Okay, whatever that means. Okay, so 3/4 length. They'll wear something
That
like
goes
that.
past your elbow.
Okay, well, something like that. Something that goes to the elbow or past it. They just want to wear that. And they can't because they're of normal weight or pretty good weight and their arms are a disaster and they can't fit them in the arms.
Disaster.
Yeah. They cannot fit their arms in a normal sleeve.
Right, especially something that's not stretchy. Like they may be really, like if you're a size medium, but your arms are a size large, like what do you do?
And you can't order, I mean, I guess you could get custom clothes made, but I mean, would be astronomically expensive.
You could just customize your arms.
By the way, did I tell you I'm a Marge? I'm between a medium and a large.
You think you are, but I don't think that's real.
Yeah, it's real.
A Marge.
Yeah. And there's only a few companies that make Marges.
Well, I mean
I should give them a shout out, but I'm not going to.
right. So I think that's just vanity sizing.
It is.
Right. Why would you not just want to be a large?
Because you like to fit it tapered. Nilsson knows what I'm talking about. He's showing his pulleys and pushies.
I don't like when it's loose.
Yeah. It can't be too loose.
Look like a box.
Yeah, exactly.
All right. Let's talk about downtime and recovery. This is a surgery not unlike some of I'm going to say any surgery that has a long incision length. So things like a thigh lift, brachioplasty, a tummy tuck, these are long incision procedures, meaning the length of the incision is pretty, notable. You will have drains. Your drains will be in anywhere from, I would say, 3 to 7 days in most cases. Some surgeons may be different there, but the drains are pretty important because this is a small area. It's kind of like a facelift, like it's very confined. So you don't want that swelling to build up and put pressure on this incision that we've just pulled so tight, to get rid of all this laxity. So the drains are a necessary evil. They're not usually too bothersome to people with the arms.
No, they don't see it. And some surgeons may not use drains, which is fine, but the drains for the first 4 or 5 days,
they're not that bad.
Gets the swelling fluid out because you really don't want a lot of super swelling on the arms.
Yep.
And that's why the drains, I think, are kind of important. The same thing is true for a thigh-plasty or a thigh lift.
Yep. And they keep you, they kind of speed your recovery too in a way because there's less for your body to have to process.
Right.
And you get less discomfort. I mean, without the drains, you could have a lot of pretty extreme swelling in your lower arm or in your hand, which could be very uncomfortable and just more work for your body to have to rid. So if you can give your body a little bit of a boost in recovery those first few days by getting that fluid out without it having to do it itself, it does help. So remember that in your mind, like these drains suck, but they are serving a purpose that is helping you heal more quickly. Range of motion, lifting, and driving are kind of lumped together in my mind because those are things that will be limited after surgery for quite some time. Depending on the length of the excision, if it's going down through the armpit or like that extended brachioplasty, even with a mini, we don't want you lifting your arms straight up over your head for 4 or 6 weeks.
Right, because if it's your elbows above your shoulders, you can really feel the tension that's going on through your arms. And that tension can cause the worst case scenario postoperatively, which is dehiscence or splitting open of the incision line. There's someone listening to this right now who's had a brachioplasty with dehiscence.
Oh, absolutely.
Yeah, it's pretty common. It's even more common in thigh lifts.
Yep.
So you got to really check yourself on range of motion, check yourself on activities. The one we always allude to, which I don't know, like Colorado's just a big dog state, but
dog walking is...
Dog walking. I mean, people, I don't know do the dogs know that you had surgery?
Right. This is when they chase
start acting like maniacs. Yeah. And then everyone's like, oh, I could either let go of this leash, which is perfectly fine. Again, you don't want to get a dog hit by a car, or I could hold on to it and just rip my arm out. Yeah. And they always do the latter to save the dog from whatever. And they fall down.
Yeah, but that's a good thing to know ahead of time. And one of the things that does complicate the recovery or the healing of this scar is that it is in a moist, wet area. Your armpit is an area of perspiration.
Mine's not, Amy.
You don't. You're like, you're freakishly non-sweaty. So most people sweat or perspire on their underarms. And after surgery, we're going to tell you can't wear deodorant or any perspirant for at least 2 weeks. So now you've got an incision in an area that you can't lift over your head to air out. It's warm and it's sweaty. And your parasympathetic system is kind of in overdrive because you're recovering from surgery.
And you're pissed off at everyone in your family because you're in pain.
Right. So it kind of creates the perfect environment.
It's true for some maceration, redness, irritation. And then what you do is you decide to do full range of motion exercises and CrossFit or day 10.
Or reach up to pull your garage door down.
That's when things split
something
open.
big. Or reach for a really heavy car door. And there's also hair that grows in this area, which can also just kind of make that incision not come together quite as easily as other areas on the body. So there are a lot of things going on in the armpit that can definitely impact the recovery, which means it can be slower.
On the bigger cases, sometimes I'll put staples in the armpit area. It's just an insurance policy.
Yep.
So when someone decides that they're going to do something they shouldn't do, it starts to really hurt.
Pulls back.
Yeah, and they stop before they split everything open.
And we're not implying that our patients are trying to do anything wrong. It's just life. Life happens, right? Even things like
I mean,
vacuuming.
I love my kids, but they still do things wrong, you know?
Yeah. And just
So,
life
I mean, it's-
happens. Your dog chases a squirrel.
I know.
You decide to vacuum because your in-laws are coming over.
Right.
You know, you have to shovel. You know, like things do come
My
up.
daughter
but-
got in the car wreck. She's like, well, he stopped suddenly. I'm like, well, but you were riding too close to the car. You know, it's the same idea here. Like you have to be defensive for the first 2 to 3 weeks after surgery and protect your investment.
Yep. And knowing ahead that these things are going to be there is going to help you, kind of mentally prepare for like, okay, like maybe I won't be able to drive for a couple of weeks, or I definitely need to get someone to come mop my floors because I can't. There's things that you're going to need help with after this surgery, even though you're going to feel pretty good. The pain downtime is very minimal with
Which
this
is crazy.
procedure.
It's crazy. It's not a lot of pain with the surgery.
Like some kind of stinging, burning along the incision line is usually the biggest complaint people have.
And if you have pain with the surgery and it's notable, then that's not normal, just so you know.
Well, pain is subjective. It might be normal for you, but it's definitely worth bringing up to your surgeon.
Yeah. Okay.
I mean,
You shouldn't have severe pain with the surgery.
severe pain. You shouldn't have severe pain after any surgery,
Yeah.
like severe pain. But how severe it is in a person's mind,
Yeah.
Can be different. If you're having what you consider severe pain from any surgery, reach out to your surgeon.
Yeah. There's like 2 sensory nerves there, the brachiocutaneous nerves. I think it's like medial and lateral. And if you hit those in surgery, which is not appropriate,
They're deep. They're
yeah,
really deep.
you can cause some real discomfort. If you suture into those,
Ooh, yeah, that would be rough.
Yeah.
That'd be brutal.
there's also deeper inside with these surgeries, there's real important structures that run through your arms, right? The blood supply, the nerve supply that goes all the way down to your hands for your muscles to work, the brachial plexus, which is in your armpit. And so if you go to someone who really doesn't know what they're doing and they do something inappropriate, you could have damage in these areas, and that would be devastating. Now, that's very unusual. If you go to a board-certified plastic surgeon, someone that does these all the time, you should feel very confident that none of those things would happen. But that's a known complication, actually, nerve injury with these surgeries.
Yeah. And that too can come from inflammation. I mean, if you have really, really intense inflammation after surgery, that could definitely cause some temporary damage to those nerves.
I feel like we've had some inflamed people that have not neuropraxias, but definitely a little bit of numbness that resolves really quickly. And that is from the swelling.
Yep. And sometimes it can also just be from the tumescent. When you numb the area up, sometimes that tumescent effect can kind of travel down the arm a little bit. And like the first day or two after surgery, your hand and arm, lower arm can feel kind of numb just because it travels, but that goes away really fast.
Right.
So, but these are all things to, just kind of, if you're experiencing those things, definitely let your doctor know about it. Work and social downtime are going to vary widely based on what you do for work and what you do for social downtime. If you love to swim laps in the pool, you're probably not going to be doing that for 6 to 8 weeks. If you work an office job, you can be back to that job in probably 2 to 3 days. And once your drains come out, especially, like you can be back to non-lifting, non-range of motion activities very quickly.
Right.
Yeah. And social downtime, like I said, it's not super painful. As long as you're not drinking or doing anything crazy, you can be back to, being social, going out to, eat, going to the grocery store.
You just can't do your juggling,
No juggling. Well, you can maybe juggle really close.
line dancing.
No line dancing.
Yeah.
Well, with your arms at your sides, you can.
Yeah, it's weird. Could you line dance with your arms? You've done line dancing, right?
Irish dancing.
Oh, yeah, right.
Oh, yeah.
Like the Celtic dancing. Yeah, you could be, who was
That's
that
like
guy with the
perfect.
fast feet? River dance, man.
Yeah, river dance.
Yeah, you can river dance. Yeah, so there's a lot of things that you'll be restricted from, but really they're things that involve range of motion with your arms. Everything else you can be back to pretty quickly. Yeah, if you have drains in, no showering until your drains come out with most providers and with us. So let's look at some before and afters.
Let's go.
Yes.
So this first one, this is on our Instagram account. I picked 2 from our Instagram just because you can go back and look at them afterwards. It's a little easier. Picture if you go on our YouTube channel right now, is someone who's had a brachioplasty with notable amount of weight loss, and actually more weight loss after the brachioplasty, which is why I like this picture.
Well, and this was an extended brachioplasty and she'd had a breast lift. So those scars all kind of.
Right. If you actually look at her after, so it's a huge improvement. It's a big change. She actually needs a bra line plasty. If you actually look at the after, if you want to be very specific.
I did part of a bra line
Well,
plasty.
but not all the
Didn't
way
do a
around.
formal one.
Yeah, well, she needed it all the way
Yep.
around to the midline of the back. And that would have actually finalized everything. She wouldn't have needed anything else. But it's a pretty remarkable change. And most of that change is from the brachioplasty extended onto the chest wall. So you can really see how much of a difference that makes also on the chest wall, too.
Yeah, and it's crazy. I mean, if you look at this upper picture, it seems like this is a person who is overweight. When you look at the lower one, she's not. She was not. She was just buried under a lot of skin. I mean, she had been very obese in her life, but had lost a lot of weight. But you couldn't really see how much weight she'd lost because there was still just so much skin.
Mm-hmm.
And I think that is really, this is such an amazing transformation. And yes, it is definitely the same person, even though her hair is different colors. She was getting married. She ended up wearing a dress that was sleeveless. Like she wore a sleeveless dress, no concerns
That's
about
right.
the scars.
In her marriage, yeah. That's exactly right.
Yep. I mean,
and she was super pumped. And she had brachioplasty scars at her wedding, visible.
Well, visible to who? Maybe visible. Did she say they were visible
No,
in her
she healed
pictures
so
or anything?
well. I'm sure by that time it was almost not visible.
Exactly. Like that's my point. Like she wasn't concerned about these scars. She had pictures taken that did not show these scars in a sleeveless dress with a low back. Definitely was.
Yeah, this is a really good
not an
picture.
issue.
I'm glad we picked this one out. But just so you can do a brachioplasty, extend it onto the chest wall, like what we said, axillary, but it's really called an extended brachioplasty. I think that's what the nomenclature should be. You can carry that down along the chest wall, the midline between the front and back of your body. Imagine the seam which the Ken and Barbie doll had. Their bodies are molded from the front and back where they meet in the middle. Yeah. So that's where that scar would go. And then you can take a right turn and do a Brachioplasty. Or you could take a left turn and connect that to a breast reduction, which we did on her, a breast reduction. Mm-hmm. So, there's so many different possibilities. This seems, extravagant, but when you've had 100-pound weight loss, 120-pound weight loss, this is part of post-bariatric cosmetic surgery that you need to use a lot of incisions to kind of get the results you want for contouring.
Yeah, a lot of skin. So this patient has never been even mildly overweight in her entire life. She's, I would say, very thin, underweight. BMI is actually underweight. Like she's not heavy.
But you can see with this, it's a 20-second video, and you can see when she rotates around, this gives you almost a three-dimensional view of what the arms look like. And also what's so great about this video is you can actually see the scars. This is fairly recent after the surgery, within a couple months. So you can see exactly where the scars are located. And Amy's right. This is an extremely normal weight person, a low weight person, actually. And she just hated her arms. Everything else was fine on her body pretty much. Yeah. And she did a brachioplasty and she had no regrets. She loved every part of the results.
Yes. And I think this was at 6 months out. This video was taken at 6 months. So by a year, that scar that you can see right now is completely gone. Older skin, we've always said this thin skin, thin scar. So tends to heal a little bit better ultimately, but is a little bit slower. But she had amazing contour to the pulley side of her arms. She had great definition,
she had
great
amazing.
biceps.
Look at her delts. Come on.
Right.
I'm starting to get a little jelly.
But that's just it. This was not a muscle issue. She had very toned arms, has very toned arms, is very fit, very active.
Was she the one that played the musical instrument? There was somebody we did this on that had, whatever, it doesn't matter. No. So there was a patient we had who played a musical instrument, that was part of it. She would put her arms out when she would play the instrument. And it really bothered her that she had loose skin in that area.
Yep, because you could see it. This was not her, but
this was an awesome result.
Amazing result. And she was so pleased. So I think we have talked about everything you need to know about brachioplasty and then some. Hopefully you feel more ready for your brachioplasty.
Let's do it. Brachioplasty, a couple things. It's one of those surgeries you probably only need one, but you could have two. It's possible, but most likely you need one.
Especially if you go on to lose a lot of weight or gain a lot of weight and then lose a lot of weight.
Right. As you age, our skin gets looser, but on the arms, once you take care of it, at least in our practice, the past 15 years of us doing surgery, I've hadn't had to do a redo brachioplasty yet. It is, as Amy said, a very well tolerated procedure, but it's annoying as hell because your arms are bound up. You feel tight. You can't move it around. So you can't just do the surgery and be flippant about it afterwards. You would agree with that?
Yeah. It does. It is a surgery. Any longer incision surgery, there's always going to be some special, considerations for recovery, especially when you have a scar in a dark, wet area.
Right.
Like take some special considerations. I think that it is interesting though, and you look at the statistics, there was the age category for like the under 18 even, and then the 18 to 25. We have only had a few patients who have been in that age range. Most of our patients are 30 plus for brachioplasty. But I definitely think if you have a brachioplasty when you are under 30, it is likely you will probably need another one.
Yeah. Depending on your skin
Yeah.
type.
Yeah. And just in general, like gravity. I mean, if it bothers you, even if you've maintained weight throughout that time frame.
Because the one thing we didn't talk about was the bariatric surgeries definitely can have some problems with nutritional deficiencies.
For your life.
Yeah, for your life. And that's okay because this is, in my mind, it's a trade-off for health and longevity, right? So every 20 pounds you lose, you may live X amount longer. I mean, to be honest with you, less incidence of diabetes, less incidence of comorbid conditions. But on those bariatric surgeries, you can have malabsorption problems with nutrition.
Well, that's kind of what they are. They're called malabsorptive procedures.
Yeah, I got you.
So you will have malabsorptive problems.
I was trying to make it easy,
Yes.
Okay? Exactly.
Yes.
You are causing a surgically induced malabsorption.
Yes.
Yeah.
Which takes a lifetime of effort to
maintain. And that can actually have effects on your skin and your skin quality just because from a nutritional deficiency standpoint. So you see these bariatric patients, albeit it's amazing, and I'm so happy for them. Our surgeries help them transform. They still are kind of fighting against the surgery itself in terms of their skin and aging and how they look. And so you have to think in your mind, if you're a bariatric patient, you've lost a lot of weight, that you may have to have touch-up procedures in the future if you're talking about someone who's 30 years old. Mm-hmm. And you're going to see this more and more. These younger generations are getting bariatric surgery. It's a lot more common, and now they're using the robots or the Da Vinci, I guess that's the brand, but the robotic surgeries, which through smaller incisions, quicker recovery, go home same day, that kind of thing.
mean, my hope is that we will actually start seeing these surgeries less and less if we could actually become a healthier population. But until then.
I don't think that's going to happen.
Yeah. Until that time.
Yeah. Overall, these patients are extremely happy with the results. We universally recommend it to our patients who are candidates without reservation. And going to a reputable surgeon, the idea of complications like nerve injuries, hematoma, bad scar formation, severe asymmetries, deformities, skin loss, tissue loss, all that kind of stuff, I think would be pretty small. And I feel that confidently. So, yeah, it's a great surgery. I think it's got a bad kind of reputation on the streets.
I don't think it does at all.
You don't listen to the streets like I do.
That's
Amy.
true. I don't. I don't have my ear to the streets like you.
No.
Yeah.
When I go out of my bougie neighborhood, you
are in touch with the common man.
Yeah, in my bougie car.
Yeah, yes.
Yeah.
The common man is just right there.
Yeah, they talk to me.
Yeah.
At the 7-Eleven, the coffee shop, the grocery store.
Yeah.
I'm listening to the peoples.
To the people. Yeah. Well, hopefully all of you people enjoyed listening to our podcast. I didn't do our social media handle call out at the beginning of the episode, but it is here now. Yep. We are on social media at Beauty and the Surgeon Podcast and also at Jason Martin MD on YouTube and all
Nils wanted me to do this.
Social media platforms. Yep. I love voicemails. If you have not listened to our
give you a voicemail.
Questions from viewers episodes.
I'm so disappointed in you. You don't beg like you used to, like Carly Rae Jepsen.
I have been. So I haven't gotten any voicemails. I actually haven't gotten any voicemails in like months, which is making me really sad. So hopefully someone out there listening to this episode about brachioplasty is going to send us a question.
We don't
send
care.
Me a voicemail.
If it's like Friday night, you're a little bit inebriated. You're like, I'm just going to call this number. Call her.
Call me. Leave me a message.
We'll put you on the podcast.
But you can leave that message or text me at 303.
To be clear, we get a lot of engagement. A lot. We get tons and tons of comments on our YouTube channel, on our Instagram, on our social media and stuff. So it's not like we don't get comments, but for the voicemails, is that just the way it is now? Is that generational?
No, it's because I stopped asking.
Oh, really?
Yes, we used to get a lot. So I would love it if you leave me a voicemail. The phone number is 303-630-9038. You can also text that number if you don't want to leave a voicemail, but we do love it. And if you do leave a voicemail, you get to hear yourself on an episode of Beauty and the Surgeon
You're gonna be
podcast
famous.
where we do listener questions.
Yeah.
And those are my favorite episodes.
They are. Those are my favorite ones too.
Yes. So thank you everyone so much for listening. It is December. So I hope you're having a very good December, ready for all of the upcoming changes in the new year and the holiday and all that good stuff. So we will see you here next time.
Did you say like and subscribe? Did you say
That's what I was doing with all the social media handles.
That's what I was pointing to?
Yes.
Gotcha.
Hit that little bell for notifications.
Ding, ding. See ya.
Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.